Hi, this is Dr. Barron with High Point Spine and Joint Center. I wanted to make a quick video today recapping your diagnosis of migraine headaches, as well as giving you some of the options that we have in the clinic to help you and some of the things that you can do on your own at home that can help alleviate some of your migraine headaches. So they're usually characterized by a throbbing headache that can be accompanied by some nausea, some vomiting. Most people are sensitive to light or noises with it. They are more common in adult women, about 3 times more common in women than men. And the frequency of the headaches usually peaks around the age of 30 to 40. And a lot of times the frequency or the intensity of the headaches can get better as a person gets older. They're caused usually by a combination of factors, one of those being some nerve irritation to some of the nerves in the neck that stimulate the scalp and the skull. There can be some irritation of enlargement of blood vessels in the brain that can be a part of the issue with migraine headaches. They tend to run in families, so seems like people can inherit some of this because there seems to be a genetic link between people who are most susceptible to them. And there's lots of different what we call triggers that can create these headaches. And it seems like there might be a multifactorial distribution of these triggers, but when they reach a critical threshold, it seems like just even one other little trigger can ensue the onset of one of these headaches. So a lot of the different triggers are things like neck tightness, stiffness in the neck, strong odors, things like perfumes, that sort of thing. Bright or flickering lights can be a problem, especially fluorescent lighting. Too little sleep. Head trauma in the past can sometimes trigger migraines later in life. Some people, even weather changes, motion sickness, things like overexertion, fatigue, eye strain, dehydration. People who are fasting sometimes can trigger a migraine in certain types of people. Hormonal changes around the menstrual cycle or ovulation can be a trigger. Even certain medications for some people can be a trigger, or food sensitivities can also be a bit of a trigger. So lots of different things. Everybody's unique in that way. I usually encourage patients to keep a little bit of a journal of their headaches, their intensity of the headache, the frequency of the headache, and things that they may have been doing surrounding it that they think might be a trigger. 20 to 30% of people who get migraine headaches get an early warning symptom that we call an aura. It can be 5 to 20 minutes, even as long as an hour of this aura before you actually get the headache. And its most common aura symptom is like a band of absent vision, or even kind of a shimmering in their vision around the border of their vision. That can be this aura. So that can sometimes give people a clue that, hey, I'm probably going to be getting a headache, and getting treatment early is usually helpful. Things that we can do in the office. So one of the big things we try to do in the office is tease out some of these triggers for you, and help alleviate with some of the common triggers associated with the neck, muscle tightness, muscle stiffness, especially in the upper cervical spine or the upper neck at the base of the skull. Some of those muscles can be intimately involved in creating or triggering some of these migraine headaches. We'll also use a variety of myofascial release techniques to try and stretch certain muscles, get certain muscles to relax. It may be even a combination of stretching, exercise, as well as dry needling, which is where we use a thin monofilament needle to insert into the muscle, run an electrical current through to kind of fire the muscle and then get it to reset and relax for us. So that can be helpful. The best home treatment is trying to avoid these triggers. And that's where some of the journaling, some of the keeping track of the intensity and the frequency of the episodes can be very helpful. Teasing out the triggers and then avoiding the main ones is kind of your best at-home thing to do in order to prevent and treat your migraine headaches. Medications can be helpful. Even the help of a neurologist sometimes is needed to give us some medications that we can use when you start to get an aura, even before you have a headache, and to kind of know what's coming on. There's some certain medications they can give you that can be helpful. So sometimes at home, it's a combination of seeking out treatment from our office as well as a neurologist if your headaches don't resolve the way we think they should. So thanks for listening. If you have any questions, please feel free to contact our office, and we'll see you at your next appointment. Thanks.